Hello, my name is Marilyn Siebold, and I am a very proud member of the board of NAMI Delaware. I've been a board member for a number of years, and I've been an active volunteer for more than 20 years. I'm also an adjunct professor of psychology at Wilmington University, and I'm really pleased to have an opportunity to share with you some thoughts and ideas and suggestions I have about social connections in a time of social distancing. So why do I think this matters? Well, I have to tell you that I really believe that words matter, and I do use certain words deliberately. I believe that, words influence how we act, and of course they influence how we work in the world. So what I wanted to do today is to talk a little bit about, we've heard a lot about social connections that are needed more than ever now, but we're also hearing about social distancing. And I'm very passionate about believing that social distancing doesn't mean social disconnecting. I'm going to tell you in this presentation why I believe that, and if I use certain words like physical distancing, you need to understand that I much prefer that to social distancing, okay? What I'd like to do in the next 10 or 15 minutes is just talk a little bit about, on a very positive level, about what we can do to sustain social connections. I believe we can still experience basic human needs of social connection, especially in trying times. We can maintain healthy and life-affirming social connections while we rely on social media or other forms of communication to maintain physical distancing. I believe we can support resilience in ourselves, our family members, our friends, and really our community through social connections, even in the time of social distancing. And I firmly believe that we can find opportunities to support healthy social connections, even in a time of physical distancing. So that is what I'm hoping to share with you today. And I hope that you were able to use some of the ideas here to strengthen your own resistance. First of all, well, what are social connections? Think about social connections as the relationship you have with the people around you. They may be close connections, like family, friends, and coworkers, or they may be more distant, like people you know only casually. So your social relationships can be big or small, but whether or not they are close or not so close, the important thing is that you're there for one another. The science behind social connections is really important. So I teach psychology courses at Wilmington University. I teach a course on intro to psychology, and one of the things that we do cover in this course is social psychology. There is evidence that humans have lived in groups for eons, and that suggests that social interaction is not just a helpful option, but it's a basic human need. We also know from research that the more attuned to others we become, the healthier we become, and vice versa. The mutual influence explains how a lack of possible social contact and a lack of positive social connections really truly diminishes people. And finally, work in social genomics is another thing we've been studying. It reveals that our personal histories of social connection or loneliness, for instance, they alter our genes, how our genes are expressed within the cells of our immune system. So why are we even talking about social connections? Why does it matter? It matters because social connections and maintaining those social connections are a basic human need, and there is science behind that. So what happens with social connections during crises? I put up a few pictures of some crises in our society that some of you may remember. Certainly most people remember 9/11 and what happened then, where they were, what they were doing. I think most of us remember, if not Hurricane Katrina, I mean, we certainly remember some of the other terrible hurricanes and earthquakes and tornadoes that have really ravaged people's lives over the last year. And perhaps if you're old enough, like I am, you will remember where you were when President Kennedy was assassinated. And you probably also remember 1968 and all the trauma that our country went through then. So what happened in those times of national crises? We wanted social connections and we made social connections. We were encouraged to reach out and be with people, to support one another. And we were encouraged to have physical connections with other people. Again, normal, typical human need, basic human need. So how is the coronavirus, the COVID-19 pandemic, how is that impacting our need for safety right now? And see, that's the key, because we are now in the midst of a crisis that's impacting people individually and in families and in communities. And how do we manage to maintain our mental and physical and safety needs, basically? Well, the Centers for Disease Control are suggesting that we be creative in how we maintain our social connections. So we need to distance ourselves to slow the infection rate. We know that, but the key is we need to be creative in how we maintain those social connections. You know, we are all in this together. And so I like that little image, to keep calm and connect. And we know that we heard the Queen of England the other day talking about we will meet again. But I want to share one other thing I heard recently that somebody shared with me, that while we are all in this together, we are all in different boats. So we're not all experiencing this the same way. But what we are experiencing is the basic human need to be connected. I like the idea of creating new ways of maintaining social connections. And I found this, some material on this I think is very interesting, to think about maintaining our social connections with both internal strategies and external strategies. Internal strategies are those strategies that help us maintain a sense of shared meaning that connects us to the community, okay? And external strategies refers to strategies that are creative ways to safely communicate through a variety of senses. And I want to talk about both internal and external strategies in a minute. I do love this image here. These are the doctors in China who were doing a dance entertainment for the patients at the hospital who were suffering with the COVID-19 virus. So they really had a very creative way of maintaining a connection in the community that they were serving. I think it's really important to remember that we need to remember our shared meaning. We don't live in isolation. You know, it may feel that way. We feel that we are isolated because we're staying in our homes and we are discouraged from getting out, but we still don't live in isolation. And the interconnectedness that we have and the choices that we make affect other people in our community. So, you know, you've heard a lot about the urge that we should all wear masks and maintain the 6 feet of distance and use gloves. Well, why is that? It's not just for ourselves, it's also for the people in our community. So by doing that, by doing the right thing, we are making choices that affect others in the community, and that is one way to maintain social connectedness. I think it's important to also identify friends and loved ones in your life that you're protecting by maintaining the distances, and to inspire, encourage, and recognize others for following protective strategies at work or at home or in the community. You know, instead of catching people doing something wrong, I much prefer catching people doing something good. So I encourage you to, when you see somebody doing something good and maintaining distances or using masks and gloves, thank them. Recognize how they are sharing a sense of community with others by doing that. Now, here are some concrete things you can do to share connections in your community. I mean, you can certainly chat on the phone with neighbors. I know I've been doing that a lot. Some of my friends have been doing that a lot. It's not the same, I think, in terms of, you know, being physically present, but it is pretty good and it's very helpful, and people love to get phone calls. You know, share, contact people, talk to them and ask them if there's anything they need. Sometimes people are afraid to ask for help, but sometimes asking for help is very stigmatizing, very shameful. So sometimes you need to encourage people to talk about what they need and to listen very carefully. Helping with chores. My sister-in-law downstate Delaware just spent the morning helping people with some lawn work that they would not have normally typically asked her for help with, but she saw that they needed some help. She called them up and they were very pleased at her invitation to help. Can you increase your donations? You know, that's another way of staying connected with the community. A lot of cultural sites and nonprofits, museums, symphony orchestras, local music groups are really suffering because they're not having their program. You know, if you increase your donation, you are making a difference. You're sharing your connections. And of course, ask for help. We are all in this together. So it's okay to ask people around you for help. We need to be positive. I understand that it's really important to have a can-do spirit, but it's also okay once in a while to say, you know, I'm hurting, I'm lonely, I'm scared, I need something. So asking for help is really good. People like to help other people. Now, other ways of maintaining a self-connection are using the senses. So we certainly can use electronics to stay in contact with other people. We've been doing this a lot. I know I have been using Zoom for a lot of my volunteer meetings lately. And it is just amazing how connected you can still be with these electronic methods of staying in contact. You can spend quality time with people. Now I have this image of this picture here of somebody doing a puzzle. My husband and I are doing some 1,000-piece puzzles, and it is really fun, and there's no pressure, but it is a way of doing something that we don't typically do with one another. And it's a nice break from the TV or the movies or the, you know, the texting or whatever you're doing. You might also want to write a journal about your experiences during this time of physical distancing. Might help you sort out what you're thinking and feeling, but can also be something you can look back at and help for future generations who want to better understand what happened. Now, another way, again, of safe connections are using all the senses. And I would suggest that you could make a meal that reminds you of friends or family if you're unable to visit them. Just this morning, I read about people celebrating a Passover feast. They couldn't be together, but using Zoom or Skype at the same time, they were making the same meals and they were sharing stories about smelling the food that they were eating and the taste of the food that they were eating. So again, it's not quite the same thing, but using all the senses can be really, really helpful. Building positive resilience, building positive relationships with people can really make a difference in how resilient you are. So it really is important to connect with people who have a positive outlook. Give one another, give ourselves the permission, you know, to have a bad day or to feel lonely or sad once in a while. But it's really helpful if you can think about people you know and try to strengthen those contacts with the people who have a positive outlook. I believe very strongly in the value of volunteering. I know that there have been a lot of studies that show that actually doing something for somebody else releases the endorphins, the body's natural painkillers. They talk about the runner's high. Well, actually, you don't have to be a runner. If you do volunteer work, it is the endorphins that are released, and it has the same effect as a helper's high. So some points maybe about using social media in a helpful way. So when you use texting or emails or any social media, it's really important to really talk and share and tell jokes, to use social media as a way of communication. Be careful not to spend too many hours just scrolling Facebook or Twitter. Some studies have shown that actually just spending hours just scrolling through Facebook can actually lead to feelings of anxiety or depression. So use Facebook or Twitter and your social media really as a way of staying connected and sharing with other people. And also, I want to say, don't try to make all your social media exchanges perfect. I mean, there really can be value just in the rituals of checking in at key points of the day. You might want to have a routine that you agree with somebody that you'll check in with them, you know, every morning or every night or at certain times during the day. It's just sort of strengthening the kind of connections that you might have had if we didn't have the physical distancing, okay? It's important to stop and reflect about how social media makes you feel. I mean, if it feels really frustrating to you, don't do it. You know, perhaps some people aren't really a good match for you right now and in meeting your needs. And don't feel like you have to show an excessive amount of positivity. As I've said before, I really mean this. Sharing a bit of your daily struggles and frustrations can be helpful. We know that talking about real situations is really therapeutic, and you can do that without a therapist. So be gentle with folks who are struggling, including yourself as well as others. And finally, I found a wonderful resource here, and I've got the link to it. 40 ways to maintain social ties during the coronavirus quarantine. And I didn't have them all here, but all 40 of them are wonderful. I mean, some I can't do. I don't do workouts. But volunteering from afar, there are opportunities to volunteer online. That is a very satisfying experience. Make some fun future plans with pals. I have a couple of friends with whom I and my husband travel a lot. Well, we can't travel now. So what we're doing during this time of physical distancing is that we've agreed to do some research and plan future vacations when we can get together. And then we check in with each other and share what we found. In conclusion, I just want to say that social connecting and physical distancing will get us through this. When we act together to maintain safety, we are connecting and bonding. We are acting out of the best parts of humanity. So I want to just end again by saying to keep calm and connect and understand that physical distancing doesn't mean social distancing. We need to strengthen our social connections. And I have here some other links, really good, reliable links, the Mayo Clinic and some other places that will give you some really useful ideas about continuing to strengthen social connections in a time of physical distancing. thank you for this opportunity to share some of these stories with you. And I wish you happiness and safety and wellness in the months ahead. Thank you. Bye.